Hi, this week we will have two important topics and two amazing guests. First one is, what type of change can we expect 2021? Can we go back to normal? And my guest is going to be Terrence Brown from Royal Institute of Technology, and it is going to be amazing. My second topic will be COVID strategy of Sweden, and my guest will be Nele, Brusselaers, who is working at Karolinska Institute, Sweden, and University of Antwerp in Belgium. Despite official claims that Sweden is successful in its COVID strategy, recent numbers shows that last 5 days hundreds of people died. Did Sweden follow correct strategy? What could have been different? And what can we change for the future? Hello everybody, today my guest is Terrence Brown, who is long-term faculty member at Royal Institute of Technology, and he has 2 PhDs. So I couldn't finish one PhD. So it is amazing to have him. And also an additional information, personal note, he was my supervisor at Royal Institute of Technology during my PhD times. Thank you, Terrence, for coming.
Thank you for having me. Happy New Year.
Happy New Year. So, you know, last year from the business perspective was really like roller coaster. Like I just don't know how it started and it ended because of COVID-19. So I just wonder, what do you think going to happen 2021? What are the trends from business perspective?
It's a good question. I mean, we did have a turbulent year in 2020, and I know that lots of people expect 2021 to be a little bit more calm and more predictable. I'm not exactly sure that that's going to be the case. I think that 2021 we should expect the unexpected. But
so it will not be back to normal, or what do you mean? Don't scare us.
Yeah, no, I don't think it'll be back to normal. I don't think it'll be back to normal, meaning pre-2020. And also, when we do get to normal, it will not be the old normal. It will be a new normal. But I think that 2021 is probably going to be a year of transition.
Transition, such as?
Well, I think that in the beginning of the year, first quarter, certainly, I think we're going to reach extreme levels of the contagion. I think it's going to many more deaths. I think that yes, the different vaccines are going to roll out. There's probably going to be logistics issues. We know that probably the Western world is probably going to be vaccinated quicker and more thoroughly than the poorer countries and the more developing countries, and so that's going to prolong the pandemic, at least worldwide. And so it's going to be a year of transition. We have a governmental transition happening in the U.S. and that's as well as between the EU and the UK, and so Israel. It's going to be a year of transition, and it's too early to tell or to try to predict what's going to happen. But I was thinking about, from a business perspective, what sort of things can we expect? And I was thinking about this. I said, well, maybe I can Google and see what some of the so-called experts are thinking about this. And I went to one of my old standbys, which is Inc. magazine. And for those of the audience that doesn't know Inc. magazine, it is it's, a magazine that now I guess is about 40 years old or so, U.S. based, but it handles small, medium-sized enterprise, startups, and that sort of thing. And it's a very good magazine. And so I said, what do they have in terms of the trends? And so they actually had an article on the 10 trends business trends for 2021, and I started looking at them, and it was interesting. It was interesting.
So can you tell us which one were interesting, or do you want to go over all these? I really
Yeah,
want to
I'm gonna
comment
go.
that.
Yeah, I want to go over a couple of them, and I think they're interesting. Not surprising, but a little interesting. I mean, the first one is that they expect a drug development revolution. And again, what they're saying is because of the development of COVID-19, and because also the distancing requirements and the whole virtual nature of things, how has that impacted drug trials and drug development?
And
And
drug
is there?
funding also. Drug funding. Now firms and also governments will want to invest more, most probably.
Yeah, I mean, and what they're saying, well, in this particular part of the article, they're talking about, how can you do drug trials at a distance or virtually or remotely? Because drug trials is usually a face-to-face sort of thing.
Yes. Uh-huh.
So how do
Now
you
I
do?
got it.
Yeah, so how do you do the drug trials remotely? So that's interesting, and I think that is is something that is going to be something that a lot of the drug companies are going to be trying to figure out. With respect to the funding, I'd like to say that there's an issue here, that this was a special case where kind of the whole world's attention was focused on this, and there was lots of funding coming from lots of different sources, both public, governmental, and private. And we were able to get, fortunately, at least we think, a vaccine type that is going to be successful. But what I think it does, it sets up the drug companies for the future in kind of not necessarily a good way, in that
Mm.
now I think the expectation is high that if something else occurs, an ordinary drug, I mean, if this pandemic you can get done and all the testing done in less than a year, when it usually takes 3 or 4 or 5 years, then people are going to expect this for everything.
Okay.
And I think that that's going to set the drug companies up for a problem down the road. But that's a whole nother topic. So the first trend was this revolution in drug development with respect to virtual and remote testing. And I think that that's legitimate, but it really is only going to impact a relatively small group of companies and a small group of people. Another trend, though, that's going to affect us a little bit more has to do with the continuing expansion of remote work and video conferencing. Like today, you and I are at a distance using video conferencing technology that actually has existed for a very long time. I mean, people think that Zoom just came out of nowhere.
No, it was already
Zoom,
there.
2011.
Like
Zoom
they were
started.
also
No, no,
WebEx
go ahead.
was already there, Skype or other Microsoft Teams, but people were not utilizing it that much. Or maybe were we not thinking that we are ready to transition or work? I
Yeah,
don't
you
know.
mentioned Skype, you mentioned Teams, Cisco had WebEx, people were using Google Hangouts,
Yes.
GoToMeetings, all of these things were out there. And I think that, it required such a significant change in the way that we were used to doing things that only a few, kind of cutting edge folks were doing it. It takes a massive shock to kind of move you out of your trajectory. And I think this was a major enough shock that caused people to kind of search for tools. And Zoom just happened to be there. But the point is that Zoom is not the end.
No.
Zoom is just the beginning. And there are going to be lots and lots of other developments with respect to remote work and video conferencing. I think this remote work, though, is a interesting one because I think that lots of companies realize now that they actually can get work done without having people in the office, without having an office, without watching over people's shoulder, at least physically. And so it's causing a rethink of how organizations are being organized and how corporate governance is done, how management is done as well. Now, it's clear that some companies are better than others. Okay, we were kind of thrown into it this past year, but those companies that have really thought about how can we make best use of this remote situation are going to succeed. I mean, some companies are not going to have people come back.
Definitely. There is, if we brainstorm there, maybe there will be remote small office spaces in addition to some small funding available for employees that they could return their homes office spaces, but and not necessarily that everybody has to be at the same place all the time. Maybe there can be occasional times to meet. I'm just thinking, like, we had so many conferences, so many big meetups. And I once in Dublin, like web conference, it was amazing, but too much crowded, too many people, different tracks, so I couldn't follow what I really wanted to follow because too many parallel tracks at the same time. Now I think, did we really need to have that type of big conference? It should be maybe small scale conferences, or not so many. Like there was a period that I was traveling all the time. Maybe we realized that we don't need to travel that much.
Yeah, I mean, I think in terms of office, I think that I'm not saying that we need to have no offices and everybody work from home, although that will be the case for some businesses. For most businesses, that's going to be an extreme case, and it's going to be some sort of continuum. I think that, yes, they'll have some times where people need to meet and people need to gather physically, but that's not all the time. That's not 100% of the time, 80%. Maybe it's only 30% of the time. Okay, maybe only 30% of the time. The rest of the time you can be home. That's gonna save a tremendous amount of money in terms of plant and equipment that can go other places. That's going to have an impact on traffic in the cities. It's going to have an impact on potentially pollution in the cities. It's going to have an impact on maybe shopping and restaurants in the city because fewer people actually have to go to the city. So this is going to be a significant change. And what you said about conferences, I think that's kind of interesting. I think that, and you and I have been to a number of conferences where there's so many things going on that you can't. First, you don't even know what's going on, and then you can't get to things. So I think that with this virtual conferencing happening, I think that it may improve some of the conferencing, whereby there's going to be kind of some sort of a list of conferences, and some of them are going to be synchronous meetings, some of them are going to be asynchronous, and at a push of a button, you can change rooms. You don't have to go try to slip in the back, be quiet, and do all that kind of stuff.
Yeah. It's something like this. One of my friends said that he went to virtual conference. He liked it a lot because he didn't feel shy to leave the meeting room. He could just leave easily because otherwise in the physical meeting room, you just feel, even though, oh, I came to the wrong place or it is not relevant to my research or my business, you just feel shy to leave if you are sitting in the middle of the room. Button of click, you can just leave. Since, I mean, it is so easy. Maybe only interested people will participate to your sessions, which means it will be much more fruitful discussion, even though there are less people. Because sometimes I see people are not interested. They are just there to be there or just happen to be there. So it will be maybe much better.
And it's also going to it's also going to change who attends because, as you know, conferences are, they're typically held in nice places, and there's a plane cost and the hotel cost, and there's a whole bunch of different costs, and many people don't have that funding. So if you have virtual conferences, it can potentially increase or democratize who can attend, and that's going to change your whole economics of the conferencing business.
Yeah, it can be maybe economy of scale, like decrease the price, more people can come. But I had a bad experience. We had a conference in Australia. I was Austria, I'm not going to name that one. So COVID came, they wanted to move to digital, but they didn't decrease the participants' price. So it was just amazing. Why do you charge that much?
Yeah, I think that it's gonna change the whole economics. I think this year was problematic, but I think that moving because they had already rented facilities and contracted food and everything, so it really was hard. But I think going forward, I think that that's going to be taken into account, and there might even be two prices: a virtual price and then an on site price as well.
How about examination? Like,
Yeah.
I think the way we will examine is going to change. I need to tell you funny anecdote from a university. When I heard that, it was interesting. It is one of the most international universities in Turkey, Bilkent University. Do you know what they send for their students for digital examination so that they can see what they are doing? What they send? They literally send mirrors. They ask students to put mirror. I can send, I will show you the video, the image. They sent students mirrors, official mirror, it was official sent by the university to the students' home so that they can put mirror. So when there's an examination, via camera, the examiner can see whether they are checking another screen to respond. So what do you think about that? I was just surprised.
I have two comments on that. The first one is, I think the Turkey situation is, it might sound kind of crazy offhand, but it isn't really. At KTH, the students had to set their phones or screens in a way so we could watch their hands and keep their hands and face and whatnot, which is virtually the same sort of thing. Yeah. So what we're talking about is how online education and e-learning is going to be has been and will be impacted by this, and I've been involved in my courses in online and learning for about 15 years, and I was so far ahead that I had to roll back. So I was really happy when this occurred, but it goes back to what I said before, that traditions are so strict in the way of doing things, so embedded, that it takes a major shock to move us. And I think this was a major shock, and this has moved us. And I think that we're not going to go back ever to totally on campus. However, I think that some institutions are going to kind of grab a hold of this opportunity to be innovative in delivering education, and some old and traditional universities are not going to be as
agile and adaptive.
Exactly.
Unfortunately. But isn't it shouldn't we change also the way that they examine? Because I have been assistant and later co-lecturer at your courses, etc. But the way that you examine changes also. You don't ask them, okay, which one of four these are correct. You just let them that they can use their knowledge that they develop during the course. You give them assignment that they learn by doing, etc. So maybe the way that we examine should change also.
I think how we look at education in general is going to have to change to adapt to some of the technology that we now have available to us. I think that the folks that want to go back so strongly and so quickly to non-digital are the ones that were not able to really think and plan and develop their lesson plans and their examinations to fit the system. They were just thrown in, and this is not going to work, and they kind of just made best with what they had. If you sit back and say, okay, how do I best deliver this education, assuming I have now all of these technologies that are available to me? For example, just for a quick example, I mean, I think that oral examinations are great.
Yes.
But it's very challenging to do oral examinations in the old system. Oral examinations are easier to do using the technology. Yes. And that's just one way in which we can do examinations. We know that peer review can work, and now with increased computerization, we can have the computer help manage these processes.
Yes.
Exactly, and this learning by doing, which of course in our field, in entrepreneurship and in marketing and in business in general, we like learning by doing because we think that that's a good way to communicate, and also for the students actually to get a strong feel for what they're doing. How does that translate to uh, the new technologies? How do we make it? How do we make it better? And again, please don't misunderstand. I'm not saying that all education all the time should be digital and should be distance. Okay, I don't think we're there yet. I don't think that we have um, the creativity yet, actually, even to think about how we can apply this to some fields. But I think that over time, more and more people are going to figure it out and say, this is a good way to do it. Um, yeah,
Definitely.
and I think that those, again, as I said, I think those schools that really see it and grab a hold of it are the ones that are going to benefit, and those old ones that can't change or not agile, as you say, um, are going to suffer long term.
But let's pick one more trend that you expect to happen 2021.
Well,
Final one.
let me do this and kind of wrap it. I won't talk about one in particular. What I will say is all of the 10 trends were related to um, using the technology to um, to have people uh, work more remotely, or work at home, or uh, um, or deliver education again at a distance, or how do we do this, the medical testing? Telemedicine is another trend. All of these have one common kind of thread, and this is not new. I heard the term that I'm going to use in a second um, over 30 years ago, and it was they talked about that we were moving towards a situation where we're going to be cocooning.
Cool. Can you
Cocooning.
explain to me and everybody who listens right now?
Sure. Just
Lecture from Terrence Brown.
Yes, cocooning. So the term is taken from the cocoon from a butterfly. So a
Yes.
butterfly a caterpillar at a certain
Yes.
age is going to then, and level of maturity, is going to build a cocoon around
Yes.
itself, and then it's going to
And
change.
they are ugly,
So what it meant, well, some people think it's ugly, some people think it's beautiful, but I like caterpillars and butterflies as well. But I think that what it meant was that people were going to develop their lives around their homes.
Mhm.
Cocooning is that where your life is based around your home and your family, where you can stay at home and work, where you can stay at home and exercise, where you can stay at home and get entertainment, where you can stay at home and go to the doctor. This doesn't mean that you wouldn't go out as well, okay? But it's home is kind of the base, and food could be developed. And from this kind of cocoon, okay, is the family unit becomes becomes the center of the world, as it was in the past, but the technology allows it to happen. And there's an emphasis on comfort, and there's an emphasis on kind of homeliness, whatever that kind of means. And so the business opportunities that allow for or increase comfort and uh, situation for mobility and entertainment and food and all of these sorts of things that can make it about making it convenient for me. Those are the opportunities that are going to really explode as we go down the road. And these things include the increase of AI, that is going to allow for these personal assistants to develop and do all of these things. We talk about smart kitchens and smart refrigerators that are going to be able to order food based upon, and then food is going to be delivered. So that requires, this year, how many things did you get delivered at home? Every day, every couple of hours, there was something else being delivered, especially during the holiday season. So all of these delivery services are going to be linked in, and the Internet of Things with the smart kitchens are going to be linked in, and we saw a whole boom in athletics and gym from home using artificial intelligence, using AR, virtual reality, and all of these things. You can see all of these things are linked, but it's around the cocoon. It's
around home. Yes, like I was thinking, because people will get bored to stay at home, but Sweden is usually, like, there are many places, there are associations. Let's say you don't meet many people outside of your association, which is close network, but you may still meet people in your association if you are in the same apartment or when villas are close to each other. But then you can have services delivered to your home, but also maybe larger services to your association. So maybe in a way that it can, like, I know some people are moving back to outside of the city because now they can work from home. But maybe inside the city we can start to form these type of small communities, because before we didn't know any of our neighbors, but because of this pandemic we start to talk to each other much more, because we don't go outside, but we are living in the same building.
Or we do go outside, but it's just walking, and even the walking puts you in contact, close contact, 2 meters, with your person across the street, which you may have never seen before.
Definitely. And so I start to realize some new shops that I didn't know that they existed, because I was just bypassing, because I don't go there. But when you start to walk, you start to see much more local shops. Maybe it's an opportunity for local shops also. So interesting. Interesting. Cocooning, some new term for us for 2021. Thank you very much, Terrence Brown, for joining my show, DrZeroShow. I hope to have you guest many times during the year if you are available, because I know I learned a lot from you. I really want my audience hear and watch you and learn from your knowledge and experience. Thank you again.
Thank you very much for having me. I hope that I do get invited back, and have a happy start to 2021.
Thank you. Hello everybody. Today I have my guest from Antwerp, Nele Brusselaers. Did I pronounce correctly?
Yeah, Nele Brusselaers.
Nele Brusselaers.
Perfect.
Welcome from Antwerp. Actually, even though you are in Antwerp, you are professor, you are clinical microbiome epidemiologist. I am reading my notes so I don't make any mistakes. And professor at Global Health Institute in Antwerp University, but at the same time you are associate professor docent at the Center of Transitional Microbiome Research at Karolinska Institute.
Yes,
so thank you very much for joining.
Thank you.
I heard about you because of the things that you start to share at social media, at LinkedIn, etc. So I became curious, the thing that you start to share. I know nothing about COVID the way that you know. I'm just trying to understand, but you are the expert in this domain. And I decided to ask some hard questions directly, and just to break the myth. So what you know, what your knowledge about the things and what your opinions are also. So first of all, do you think Anders Tegnell is a qualified person to talk about infections in Sweden or in the world? Why not?
Well, the first time I heard about his existence was early in the pandemic, in March, when it was not really, or end of February, when it was not even labeled a pandemic yet. And actually, from the moment I heard about his existence, I had my questions because he was apparently claiming very loudly that the pandemic was never going to come to Sweden. And then he was claiming, oh, the numbers are going down. And at that time, I was already thinking, like, how can you say that the number of infections is going down if the numbers are going up every day? So I checked his resume quite early because I was indeed wondering, like, why does Sweden have a state epidemiologist and who is he? Well, based on his resume, he should have some experience. He has a master in epidemiology from the London School of Hygiene and Tropical Medicine, which is a really well-renowned university, especially for epidemiology in London. I also studied there, and he has a specialty in infectious diseases. But
So what
for
is
me,
wrong?
he's not a scientist, he's a bureaucrat. He's not been publishing research himself. So yeah, he did a PhD, but that's ages ago. And he never went to the stage of an independent researcher and a senior researcher. And so he basically just went into policy. And I was a bit surprised because I was thinking that someone in his position or in that institute, Folkhälsomyndigheten, should be in a position to still be a researcher and still publish research, but he apparently chose not to do that. And I must say, I had questions from the beginning, and basically, yeah, the whole year already, which, yeah, about his knowledge about this pandemic and his many controversial statements in which he often contradicts himself, even in the same sentence.
But this comes to my follow-up question. Do you think Anders Tegnell is qualified person to make decisions in Sweden? Why not?
Well, he basically only has the authority to advise, and I don't think it should be in any country. It should never be one person advising a country in any disaster, if it's a tsunami or a pandemic. There are many qualified researchers in Sweden who could do a way better and more comprehensive job than just one single person, whoever that person may be. You should look indeed to the bigger picture, economy, social life, and of course health primarily because it's a pandemic. So I don't think he doesn't even have the mandate to make decisions, but somehow the things he has been saying the last year have been considered as a truth. If he said, "Oh, I don't believe mouth masks work," they have been interpreted at several places like, "Oh, mouth masks are forbidden." Many schools, many even clinics have used that statement, "Oh, it's the law, we are not allowed to wear mouth masks," which is a
Really?
complete misinterpretation of the evidence, and it's just based on what one single person just says. And yeah,
But
he's
are
also
you
been
sure? Because are you sure one person, single person is saying, or maybe he is just talking with other researchers, or he's just saying what researchers are saying?
Well, I do wonder if there are many researchers, qualified researchers, beside his statements. If you follow the international media, we know for a long time already that mouth masks. We know for decades that mouth masks do protect against infectious diseases. That's why surgeons and nurses wear them in an operating theater. So of course they make sense, and there is no single harm associated to them. So there is, of course, evidence, and we know, or even the WHO has been saying that there is aerogenous spread in March. So meaning that those plastic face shields, they're not enough to stop the protection. So we know already for almost a year now that mouth masks can help reduce the infection. There are almost 100 studies showing evidence supporting this, and there is also no harm in using them. So, okay, but then you go to the website of the health authorities, and then there are claims like a whole list of things like, ooh, side effects of mouth masks. You can get acne.
Mm-hmm.
Well, a little bit of acne is maybe not as bad as dying or
Mm-hmm.
contributing to the death of your family members or teachers or grandparents or neighbors. So it has been misinformation about mouth masks. There has been misinformation about asymptomatic spread. So basically that you are infectious before you have symptoms. It's also on the website of the health authorities that that asymptomatic spread is only contributing to a minor part of the spread, but then international estimates basically says at least 40-50% of all infections happen because people are already infectious, they already transmit the disease, but they don't have any symptoms yet. That's information we have for almost a year. And
But don't we say if you don't have symptoms, you can go to job if there's no symptoms?
Yeah, and they've even been saying early in the beginning of the autumn that even if you have symptoms, your kids should go to school. And yes, you can drop them off at school and you can go to the supermarket. And knowing that nobody was wearing mouth masks at the time, it's like it's no point of putting them in quarantine because people don't stay at home. And some people are still spreading the infection around. So
It comes to my follow-up question in that sense. So based on information that we have,
yes.
because we don't know everything, do you think we should keep schools open because kids are not infected apparently?
Kids are infectious. Kids can spread the disease. It's a very difficult question, and it depends on where you are in the pandemic. If there's a lot of spread in the environment, if a lot of people are sick in an environment, it should be one of the options to stop the the burden on the healthcare system. Now in Sweden, we know that many hospitals, many regions are under a huge strain because they cannot cope with the influx of the patients. They cannot offer everyone treatment, and they still don't do enough to stop the spread of the infection in society. So then I think really that you should consider closing the schools, at least temporarily, because indeed if you do strict measures for a short term and everyone follows them, if everyone stays at home, I was making the example today, if there would be a huge snowstorm and everyone is forced to stay at home for 2 weeks, then basically you would get rid of the infection, of the pandemic. But then I still, of course, it is really important that kids have education, and at least also that the parents have can continue their work as well, because if your kids are at home the whole time, you cannot work as you should, even if you are a researcher as I am. But then the risk, I think, they talk a lot about the psychological health of the children, and of course everyone,
even the parents, like even the grown-ups, like staying at home all the time, psychologically influence people.
But you can explain that. You cannot explain what's going on to a 3-year-old, to a 4-year-old. They understand. You can already teach those small children why you have to wear a mouth mask when you go inside. So and I still think it's better that you protect your children and inform your children than that you just let them run around and that they think, it cannot happen in the schools. If you hear all those stories of people that their teenagers have been sick with COVID, and then the school is like, no, don't tell it around. The others should not know, otherwise there is a stigma. So then they don't even, as a parent, you don't even know that the classmates of your kid are infected, which is for me completely unacceptable. But then, imagine that one of those kids that you get infected at school and you infect your grandparents.
Yes.
And those grandparents or your neighbors die. Isn't that the bigger problem than if you have 2 weeks of extra holiday at home or some work assignments?
Like I remember this was Angela Merkel's statement also, like stay at home so that it is not going to be your last Christmas with their grandparents. But then I have another question. Don't you think those people who have died would eventually die anyway? Because they were already old.
Yeah, we all die, but then if you're already at an old age, then the probability that you will survive for quite a while is actually not as bad because you are already old. So of course, elderly people die and young people can die, but then if you hear this, how people have died in Sweden, if you are in elderly homes and that you don't even, that the physician doesn't even come and looks at you, but just gives you morphine. It has been all over the media and there was no outcry. So those stories have been correct. There have been enough reports on that.
Just to help me understand. So you said they just give the morphine to reduce the pain, but they didn't try to save?
Morphine is basically palliative sedation. So basically, they give morphine to just make the end of life easier. It's not
Wow.
to relieve the pain. We know that we've seen in other countries that even people above 100 have survived COVID, but then you just have to give them some treatment, at least oxygen. But if you, apparently in some elderly homes, they just stopped all the treatment, they even stopped feeding them. They just gave them
Really?
morphine. Yes.
But is it a speculation or is it a fact?
Yeah, it's been all over the media. Several geriatricians have been testified about it. There are enough reports of children who lost their parents and they just got a phone call like, "Oh, your parent died," and then they don't. Many of those elderly people didn't even end up in the records because they also have dementia or they have diabetes, so they died from the diabetes or the dementia. No, well, 2 days before they were completely healthy, and then suddenly they got COVID and they die.
But also,
So
I read some people say, oh, they would have died in a year, so maybe they die earlier with dignity. What do you think about that?
they don't die with dignity now. It's a pandemic. They don't count. If you have an overburdened healthcare system, you don't die with dignity because you don't even see a physician. You can't even say goodbye because then, the children, the grandchildren can't even say goodbye. And yes, the life expectancy for many people ending up in an elderly home is quite short because people go to elderly homes when they need extra care, and many people wait for a long time before they go there. But that doesn't mean that there are no people who survive more than 10 years. Even my grandmother has been in an elderly home for more than 10 years, and she's still alive, luckily in Belgium, not in Sweden. But then, yeah, it's not because you're old that you're going to die. And we should also not forget all those healthcare workers and children. There are at least 7 children who died in Sweden because of Corona. And I don't know how many healthcare workers have died. That's something they try to keep out of the media, I have the feeling. But those healthcare workers, they should not have died. If there was no pandemic, if they would have stopped it from the beginning, and Sweden was in a very good position from the start to suppress this pandemic, they could have been like Australia, New Zealand, Taiwan, while they chose to just act as if nothing was happening. Yes, the burden of this pandemic has been worse in other countries like Belgium, UK. They have been hit very hard as well, but they're in the middle of Europe. The population density is 10, 15 times denser than Sweden. For example, countries like Belgium, France, the Netherlands, they don't even have proper frontiers. You can just cross the border at every meter of the, so you can't even control it. And in Sweden, then you have, most of Sweden is empty. People live far apart. There are so many single person households. You have clear frontiers. They could have acted together with all the Nordic countries. They have a population who listens to the authorities, which is also not that easy in many countries, which is then for me so contradicting as well. You have a population who listens to authorities, and it's probably the only country where the authorities are then basically giving misinformation to the public.
In, Interesting. Oh, so I wasn't expecting that it is that bad. But anyway, do you think there's also like I will come back to these infection issues, but because there's this type of thing, I meet some people they said I already had a COVID. So is it like that if one person is infected with COVID, it is over, you survive, so there's no problem at all?
Well, first of all, we know that many people who got COVID already in March, April are still suffering, the so-called long haulers. So they still have problems with blood pressure, fatigue. So I heard from people in their 40s who can't even walk for 100 meters and they're exhausted. We also know that many people lose their immunity, so you could be reinfected just a couple of months later, just after, I think after 4 months or something, already 1 in 5 lost immunity. So the longer you are after the infection, the higher the probability that you get it again. I personally also know a few people who have been infected twice, also one healthcare worker, because they're working at the COVID wards without proper protective equipment, so it's no surprise that they get infected at work. So no, it's not that you're protected.
But maybe you are listing the extremes. Is it like are you listing the extremes just to make your point, or do you want to say we don't know enough yet?
Of course, we don't know enough yet, but then that's also something. The vaccines are hopefully gonna be a help to help to get us out of this pandemic. But that's also something we don't know how long they will last. But that's something we know from all the from all infectious diseases before. For many of the vaccinations, we also need to have a reboost after a couple of years, or we need to have several shots, like 1 month in between and a year after. So it's just something. If it's a new pathogen which comes to our knowledge, to the knowledge of our human,
There's
human
new
race, then
variation is also coming.
and that's indeed something. Okay, we don't know for sure. We know already very early from spring that people have been infected by the virus, and it has not. It was quite clear from early on that it was not just the same infection starting up again, because they really could see in the genetic code of the virus that it was another one. Now we have different strains: the UK variant, the South African variant. We don't. The evidence now suggests that they are more infectious than the one before. But indeed, it's a virus that we don't know sufficiently. It's the first time that we have a pandemic, to our knowledge, caused by coronavirus. So there are indeed still question marks. But then, if you see the amount of research that has happened in the last year, it's just amazing. I don't think there was ever a disease leading to so much research effort internationally, but also within Sweden, to look into stopping this pandemic, or slowing it down, or slowing down or improving the treatment. But then and the long haulers, like they call the people with the long-term symptoms, it's also something that has not been studied for a very long time. Will they be sick for forever? There are several infectious diseases that people have long-term sequelae of an original infection. For example, hepatitis. You can have symptoms of your hepatitis for years after. You just never get rid of it. But for corona, we don't know how long they will last. But we know of several people in every single country who have symptoms months after the original infection.
Okay, thank you very much for scaring me. but do you think immigrants are the cause of the spread in Sweden?
Say again, what the cause is of the spread?
Immigrants.
No. Immigrants. Well,
because this is and also why Sweden is much more infectious compared to Norway and Finland, because this was one of the cases described by Anders Tegner.
Yes, that was something that shocked me from the beginning, that they dare to say that. If you would make a statement like that in any other country, you would get a very big backlash. It has been indeed presented at the press meetings of the health authorities, even with graphs, even naming Yugoslavia as a country. For me, there are socioeconomic differences between different population groups, but to just blame it on immigrants is just a big no-go. We also know when everything started a year ago, it was mainly people coming back from skiing holidays from Austria, Italy, France. Many skiers have brought back the virus, and if it's in Sweden, then they are not immigrants. Just to blame it on the immigrants, or make statements like, oh, it's the immigrants who brought it in the elderly homes because immigrants are not hygienic, I think it's a big no. You cannot say that, and it's just not because you are not Swedish that you spread an infection. It's way more complex. It's more social behavior as well, and of course, social interactions. It's not because you're not Swedish that you spread an infection. So for me, it's just a very unnuanced statement, and I was really shocked that there was no outcry in Sweden. And many people, even people with foreign roots, just copied the same. Always the immigrants. It's only the immigrants dying. So it seemed to be part of that big thing, like, oh, we should not scare everyone. It's not gonna touch you. It's only the others who get infected and die. They are still residents in Sweden. They should have the right to have the same access to healthcare. They should have the right to be protected, and the same rights as every individual living in Sweden. So you shouldn't single them out. You shouldn't brand them as as it has happened in many countries in the beginning that they also said like, oh, it's the Wuhan virus. No, it's not the Wuhan virus. It's a coronavirus. And yes, it has been detected in Wuhan. It doesn't, there is no blame in this.
But
And
no,
even
is it the
yeah,
same for, sorry for interrupting, like we say Spanish virus, but it did not start in Spain, it was detected in Spain,
yeah,
and then so maybe
yeah,
researchers in Wuhan, they were able to detect an
yeah,
unknowns because of that. Maybe it was somewhere else. Do you say
yeah.
that? Like,
Yeah, but yeah, we don't know. For the coronavirus, we don't know exactly where it originated. The outbreak, the first big outbreak or epidemic was in Wuhan, but we are not for sure that it started there. And even if the origins are unclear, we have a global pandemic now, so who cares where it came from? We
yeah,
just have to
that's
handle it. And for me, as an epidemiologist, you see a pandemic or an epidemic happening in a faraway country. Okay, at that time, I was already on the tips of my toes, like, oh, there is an epidemic happening, like the Ebola one a couple of years ago. And then I was already like, whoa, what's going on there? But then, the moment it jumped to Italy, then all countries should have acted fast
is
and
it?
swiftly, like, this is on your doorstep, you should do something about it, and you should make sure it doesn't happen. And then you just don't say like, oh, we will see in 2 years, everything under control, nothing to worry about. No, you have an epidemic, your neighboring countries, okay, it's not exactly neighboring, but it's on your doorstep. Italy is having a huge crisis. You should act, you should be prepared.
It,
and
it, it
and
sounded like
mm,
this. People sometimes said, "Oh, we will see the total consequences," but they consider the psychological infection
mm,
and then economical consequences in couple of years. So we should do calculation in couple of years, not now. So we shouldn't be harsh to understand now, or we shouldn't be harsh to in other
mm.
countries because nobody knows whose method works better. Don't
but
you agree with that
mm.
one?
But there is already research from 100 years ago. We had the Spanish flu almost exactly 100 years ago. And, from earlier epidemics, we know that swift action shows like, that's something they have been doing for ages. If there is an epidemic in a city, they close down the city so it doesn't jump to other cities. Of course, if there is no contact with other cities, it will die out, the virus, not, and hopefully not that many people. But then, there is evidence enough that if you act, it's an infectious disease. And at even especially the earliest results from China, from Italy, from Iran, the numbers looked really bad, because then they didn't know that there was such a high proportion of asymptomatic spread. But then still, if 1%, or even if it's only half of a percent of the people who get infected die, and you let everyone to get infected, that's thousands of deaths. You just
Mm-hmm.
cannot let that happen. Even it's only 1.5%. If you have 10 million people, it's thousands of deaths. So you can't just wait. And that's something we've seen also from other countries. Just letting it free, it's bad for the economy. It's bad for
Mm-hmm.
the pandemic. Now, also one of the things people have been fearing, if you just let it linger around in the society, then you also have a higher risk of mutations. What's happening now in UK and in South Africa, there are mutations which can become less harmful or could become more harmful. And in the
Because they
meantime,
say
many people.
something they say
Mm,
like this, the thing in UK might have happened at somebody who had a weak defense,
mm,
but the virus was able to survive, and then they were
well,
able to match like a new
yeah.
variation.
But then still, if you have, it's not going to be in one single person that the virus
Okay.
has been mutating. Viruses are constantly mutating. But the more infections you have in a certain region, the higher the probability that something will mutate. If you are in Southeast Asia, there are countries where they barely have a couple of hundreds of infections. Mutation will not happen there, and if it would happen, they anyway limit the spread of the infection. So
Yes.
so then it's never gonna spread out. And that's what's, in the UK, it's all over the place. It's now in the meantime already over Europe. So if you don't stop the pandemic, you're not gonna stop the mutations.
Yes.
Plus you also yeah,
This
sorry.
comes to my follow-up question. So I want to ask, because you are already answering that one. So what do you suggest? What we should do? Are we late Like, is it the only way that everybody should get infected? Are we late, or what should we do right now in Sweden, in Europe, and is there any good examples that we should follow in other countries?
Well, I would anyway still, even in Sweden, although it's late, and I've been hoping for tougher restriction or at least accurate information since spring, and we've seen it's not happening. It seems that those in charge are just waiting to act. But then still, if you would, implement strict restrictions, just mouth mask basically every time that you have a contact out of your household. Even just mouth mask, we already know that it has a dramatic effect in reducing the number of infections. So it's not that you have to go into the severe lockdowns as they had in Europe in the beginning, that you were only allowed to, see one person. But then, I still think they should do something in Sweden. They can't just wait until the vaccine comes, because we also don't know how well the vaccine will work. We will need it. We will all need to get vaccinated to get rid of this. But then every single country in the world needs to be vaccinated, and that's a big challenge.
So
But
do we
just
have enough
mouth mask.
vaccines?
Not yet, and especially the willingness to get vaccinated is not as high, and there will always be people for whom the vaccine will not work. That's for every vaccine the case, and that's why you need to have such high numbers of people vaccinated, so you can also protect those for whom the vaccine doesn't work, and also for those for who cannot get vaccinated because of underlying illness. But
Okay.
I still think if you just limit social contacts drastically, no gatherings of several people, and just, stick to your regular contacts. Just, if everyone would do that, just stay, if you would only see 2 or 3 people for a month, to say it extreme, then it will be, then, the virus doesn't have the opportunity to jump from one person to another person. So, but then you don't have to go that extreme, but just if you do an extra effort in, for example, in the schools, to keep the kids kind of apart, to go part-time distance learning, to do, let them have their lunch in the classroom instead of in a big, dining room with 400 kids at the same time, then you limit the exposure to other people, and then you limit the risk of transmission of the infection. So, and for me, the idea that your healthcare system is on the verge of a collapse, it's so extremely scary, because that's happening in Sweden. They have been postponing healthcare. They have been postponing cancer surgery, for example,
Is it?
for months.
Really?
Yes. Yeah. Of course, they don't have enough personnel. It's not a matter of how many beds they have, but it's also a matter of personnel. They are using operating theaters, even lunchrooms, as places to treat patients. And yeah, if you don't have the manpower or the woman power to treat your individuals, you have to postpone the healthcare, which is not extremely urgent. But then now we already 1 year into a pandemic. You can't keep, if people who should have gotten their surgery a year ago are still not operated, well, many of them will have died in the meantime.
Okay.
And I've even heard of people, elderly people who broke their arm, were still living at home, and then they just, in the hospitals, they were just saying like, oh, we only give palliative care to elderly. They don't even give a cast.
Is it
Yes,
speculation or is it the fact? Like, you surprise me.
I can provide you the name if you want.
Okay. Okay. Like,
So
whoever needs the name, they can get in touch with you. Then,
yeah,
like, it is better not to
yeah.
name the
I I
persons.
I know it sounds so incredible, and all
Unbelievable.
those.
What you are
It's
telling is like something
it's still
unbelievable.
Sweden. Yeah, it's still Sweden. But then if you see, and that's for me the shocking thing, especially during the first wave, they were saying, oh, we still have so many empty beds. We still have so many empty
Yeah,
beds, and then
this
you
is
hear of
what I
people
heard.
dying at home. You hear about people dying at home because they were, oh, you're not a risk patient. Oh, you're too young. Just go home, and then they die at home. It's all been over the media as well. So there are many people interviewed, testimonies of children or relatives have been in the media, so they can be verified. But then still, for me, it was shocking that you don't still say like, oh, we still have beds, everything under control, while people in the elderly homes are dying. And it's still a crisis, even if the numbers seem to be looking better than in other countries.
Okay. Thank you
but
very
then
much.
it's still way worse than the other Nordic countries.
Yeah, but other Nordic countries doesn't have enough immigrants because of that. Maybe.
They
Uh,
do have, and they do travel as well. But then they do drastic measures early on in the pandemic because they were still, protecting, and they were prepared, or more prepared in Sweden.
Thank you very much for joining. It is you scared me, to be honest, but I think
Sorry.
somebody should maybe say what they know. Like at least we can say that these are the information that you have according to knowledge that we have until now. Maybe tomorrow you will say something else according to knowledge that we gained that time. So science is like this. You cannot say this works, this doesn't work all the time because maybe knowledge will change. This is the same how this is the same as we.
It should be a group effort as well. There are so many people who have useful information and knowledge and experience, and that's a resource which has not been used to the full extent in Sweden.
You remind me one final question before I get. Did anybody got in touch with you to get your input because you are publicly criticizing what is happening in Sweden? Did anybody get in touch with you from the public authorities? Do you want to help us, or do you want to share your knowledge?
I know several of my colleagues, or indeed colleagues that I've got to know during last year, have reached out to them, and they all said like, no, we don't need help. So even close people I was collaborating with, we also actually reached out as a group, like we're doing modeling work. We want to offer our help, and they say they don't need it.
Okay, so interesting, really interesting.
Even for testing, even for tracing, even for logistic support. I know of many people who offered their support, but they were like, no, we don't need it.
Okay.
So
interesting to know.
That's why we also started the scientific forum, because we as researchers, we wanted to indeed discuss and do still something to help.
Can you tell the URL and then we finish the interview? Scientific forum dot.
It's vetkov19.se. So it's a Wetenskapsforum COVID-19. We're on Facebook, and and the aim of our group of scientists, we are in the meantime like with 45 scientists approximately. Our aim is to inform the public and give them accurate information according to the international standards, we just want to help. We just want to help the situation in Sweden and improve it and reduce suffering.
Thank you very much. I appreciate your efforts. I hope it is going to be helpful for the people who watch this program. Have a nice day in Antwerp, and take care of yourself.
Thank you. You too.
Thank you very much for watching. Don't forget to follow me at LinkedIn, Facebook, Twitter, DrZeroShow. If you search, you can find me.